When I think back a year ago, I'd say the process was transformational. What it has added in quality to the time that we have now is irreplaceable.
Thank you for being willing to spend some time with me, willing to be on camera, record a testimonial so that other people like yourself who are curious about the process of neurofeedback can hear from people who've gone through it. What brought you to, making the choice of calling for the consult?
Right. So it was a little bit of divine intervention, I would say. Josie started exhibiting symptoms and impulsive behaviors, I would say, is the nice way to say it, in first grade. And we worked through several different diagnoses and therapies, and we had gone through some neuropsych testing, tried some medications, and nothing really seemed to be getting at the root of that impulsivity. And I was starting to notice that not only was it affecting us at home, but it was affecting her at school. It was affecting her ability to communicate effectively with her classmates. She wasn't building connections. And I have two other kids who have ADHD. And so I was familiar with some of those behaviors, but Josie's was always different. And we really struggled. We struggled, especially during COVID, with getting schoolwork done. Our school stayed in session remotely. And so it was very full days. She was in second grade. And it was really, really hard. And in our family, the rest of us, we would describe it as we would walk on eggshells because there was no consistency to her impulsive behaviors. And there didn't seem to be any motivation for it either. And so it was really, really hard. We all kind of were saying we were walking on eggshells because you just didn't know what was going to set her off when. And it was anything from, just big behaviors. There was never any violence, but very big emotional responses to very small to the neurotypical brain situations. And it was a lot. So we explored a lot of different options. We got her tested, we got her into therapy, we tried meds, and those things were helping a little bit, but they really weren't touching that impulsivity. And we lost her dad, and things just became even bigger. And I was on my own, and it was just, I was sort of at my wit's end. To just put it bluntly, I was at my wit's end. I couldn't find a reason for these behaviors, and there was no consequence I could give that would change the behavior. It was just staggering to me. So fast forward a little bit, I was having my daughter evaluated and filling out forms and read for the first time about this QEEG test. And as I was reading about that test for her sister's evaluation, because it was going to be part of that whole battery of tests, I was like, gosh, I wonder if that would give us some answers about this really unique behavior in Josie that we can't seem to put our finger on. I then, in one of Josie's therapy appointments, mentioned and asked her therapist if she had heard of this QEEG. And she said, well, as a matter of fact, there's this clinic right next door, and they just did a lunch and learn for us. She said, I think that would be a really good thing to try. I was like, great. That's what led me to you.
Okay, those kismet.
Yeah, it was really those things lined up perfectly at the right time where I said, okay, I don't care. I mean, I care how much it costs, but in my mind, it is an investment in her well-being. If it gives us answers, if it gives her some relief, we'll find a way to make those costs happen, make that payment happen. So yeah, that's what brought me there.
Right. And as you were kind of sharing what your day-to-day was and how like Josie's behavior, I'm reminded of one of the core findings in her cue, dysregulation between the anterior posterior cingulate and this core regulatory circuit that so much of our brain and in a sense our cortex or executive function rides on the stability of this core circuit. And for Josie, that was significantly dysregulated. I mean, so many of the findings pointed to that. It couldn't have been a better match between what you were experiencing at home, and you had not found medications or therapy to be all that helpful because of what we saw in the wiring patterning in her brain activity. From my side, and I get the sense that it clicked for you as well. Here's the thing that explains what you're experiencing, what Josie's living. And yeah, so what did you kind of first start to notice, and then how did that progress towards kind of her graduating from the program?
I didn't notice anything radical right away, which you explained was normal. I think it was over time that I just started to notice, how they say you never know when it's going to be the last time. I started to notice that, gosh, we haven't had this like storming off and slamming your door behavior that would come. I mean, that was frequent in our house, when she didn't like what you said, or I told her to do something she didn't want to do. It was just straight to her room and slam the door. Sometimes throwing things in her room. I could hear screaming sometimes. And it was like all of a sudden I realized, gosh, when's the last time she responded that way? And it was slow. And she also suffers from pretty severe anxiety and has had a lot of gut issues and illness and missing school. And so she did miss several sessions. So that's why it took so long to get those 40 in. I noticed very slowly that nothing huge had changed, but the big behaviors were getting quieter. I could still see the responses. She was also slowing her thoughts and her responses like in the moment. Not always, but I noticed that she sometimes would remember to take a beat. So yeah, I guess when I think back a year ago, I'd say the process was transformational, even though throughout the process, I really wasn't noticing a lot. Does that make sense?
It does. We think of neurofeedback as a learning paradigm. And if you're learning something, I often use the example of a musical instrument. So if you're learning to play the guitar, like at what point do you say, I've learned to play the guitar? Like every lesson, you've learned some piece of a skill, and then you keep putting those little bits of skill together. And then pretty soon you can do something like you can make your way through a scale. Well, can you play a guitar yet? Well, not really, but you can do more than you used to, right? And that's this is the exact same process. Is, we help the brain, lay down new neural pathways, and that takes some time to develop those neural pathways. But then that brain still needs to decide, use the old pathway or use this new pathway. And in the beginning, it tends to go out of momentum, uses the old one, but eventually it'll try the new one. It goes, oh, actually doing this new pathway, the results were better. My life went better this way. So then it'll use it again and again. And then maybe one time it goes down the other pathway. And then it's like, yeah, no, actually turns out that isn't actually as good as this other pathway. But one of the things that you had mentioned, we had talked about clinically, but you mentioned here, is how things were kind of unfolding at school and for her with her friends.
That's a good question. So I would say in the spring when she started, school and friendships at school were pretty hard for her. And she still struggles, but she really would read situations wrong and she would react to what she saw and what she thought was happening. Not be able to really connect with her classmates. What I noticed is when she started school again in September, she was making conversation with friends. She was sitting at a table with people at lunch where she used to sit alone. So part of that was, I think, just maturity. But I definitely think that part of it was feeling more confident in her ability to make those connections and kind of taking a chance that the work that she was doing was going to support that. So she did. She took a chance sitting with a group of people at lunch and making conversation. And she would come home and say, yeah, I talked to so and so and I sat with the group at lunchtime and we talked, and she'd sit with her volleyball team and just connected with them. And that I was a coach for volleyball, so I could see those connections in practice too. That was another place where she really struggled last year, especially if something was hard and she wasn't being successful right away, would set her off and she'd miss the whole rest of the practice. And that still happened, but it happened far less frequently this fall than in last year. What I would add to somebody, to like advice or experience, sharing experience, I know I've heard people talk about, how much time this takes. And it does. It's a commitment. It's a time commitment for sure. And I was blessed to be, it happened at a time when I could make it happen and get her there most of the times, or get help to get her there. And I would say to anyone who would use that as a reason not to do it, I would say it did take time away from other things, but what it has added in quality to the time that we have now is irreplaceable. I mean, and we'll go back. I mean, we're gonna continue and start up again soon because I think there's more work to be done. And I think she can continue to benefit. It was recommended by the clinic that did her last, an updated neuropsych. They said absolutely continue that because it's shown to be working. But I would say to anyone who says, it's just so much time, it's worth it because it's an investment of time in a quality of, their well-being. My other daughter was having trouble focusing on an assignment one day, and I'm like, hey, why don't you try the AV? And she did, and she put on the whole thing with the see-through goggles, worked on the assignment, finished it, and she's like, looked at the time, and she says, oh my gosh, I thought I've been working on this for like 4 hours. It only took me 20 minutes. So it really, really worked for her. And she has used it since then because
Fantastic.
it actually really worked.
Well, that's great. I'm glad that it's getting a little general use in the house because that's what we hope will happen with the devices because any brain can benefit, right? Like a brain doesn't have to have a problem that needs solving. It's just any brain will benefit if it's better organized. And your daughter with ADHD is a great example of she popped the glasses on and just immediately the thing that was difficult became easier.
Yeah.
And for her, no doubt, a challenge would be paying attention for 20 minutes in a row to just complete an exercise, homework or project in 20 minutes instead of 4 hours. And I mean, we just see that kind of thing all the time. It's like that simple. Put it on, starts working in 3 minutes. It's organizing the brain. The brain just functions better. And then you just do life better. Whatever it is that you're doing, you just do it better. Thank you.
Thank you.